Hello and welcome to Ask Miss Jai Live. I am very excited to be coming to you today to talk about creating your trans inclusion program plan. I am going to be focusing a bit on a public health program plan, but I think a lot of what I will share in terms of tips for you will be applicable regardless of the program that you're offering for your community. So we're going to be talking about some of the things you can do before creating your work plan, some of the things that you can do in order to prepare your organization to better serve trans and non-binary communities, and what you can do once your work plan is in place as well. So stick around. I'm really excited for this conversation today for the season finale of Ask Miss Jai Live Season 4. Hello and welcome back to Ask Miss Jai Live. I am Miss Jai. I use she, her, and he, him pronouns. I am the founder and the host of Ask Miss Jai Live, and I'm excited to be here. If you are catching this live, go ahead and put a hashtag live in the chat. Let me know that you're here. Say hello. If you are catching this on the replay, go ahead and put a hashtag replay. I'd love to hear your questions, your thoughts, your comments. If you're working in the field as well and you have other recommendations on ways to make a program affirming, please share those in the chat and in the comments below so that we can collaboratively help folks create affirming programs. I come to you live every week, or I have been coming to you live every week. This is our final show for season 4, and then we are going to be going on a break. We are also determining if Ask Miss Jai Live is going to be continuing on or if it's going to shift into something new. So please let me know in the comments if this has been helpful for you or if there are other ways that you would like to learn about how to better serve gender expansive communities, ways that we can shift to better meet that need as well. So I'm really excited to be here. My background is in public health and in healthcare. I've worked in the field for 15 years now. Oh my gosh. Suddenly when it hits you that you're older than you thought you were. I've been working in the field for 15 years now, since 2011 when I started my first position in a public health organization. And during that time, I have consistently advocated for the inclusion of gender expansive communities in the work that we are doing, because they're oftentimes our community is unmet in terms of our health needs and in terms of programming that addresses our health needs. So today I'm going to be talking about some of the things you can do to create an inclusive program plan for gender expansive communities. The reason why I'm coming forward to share this information with you is that oftentimes in the work that I do now, I'm asked how organizations can be more affirming, how programs can be more affirming, and how those programs can meet trans and non-binary people where they're at in order to get their health needs met. And so these are some of the tips that have come up that are pretty consistent across organizations. There's always going to be some nuance to the program that's being provided as well, and including like who your audience is, who your participants are, the age ranges, if there are certain communities you can or can't work with depending on funding streams. So please keep in mind that these are some general tips, but that there are more nuanced ways. And if you have a nuanced challenge that you're experiencing, share it in the comments so we can work on it together. So the first recommendation that I provide to you is that you want to meet with your community champions. So before creating your work plan, I encourage you to meet with trans and non-binary community champions and stakeholders, organizations that are already serving trans and non-binary people, to get some understanding as to what the health needs are and what some of the asks are. I think sometimes when we create programs, we might create them for and not with. And so if we're taking the opportunity to meet with our community first and find out what the community is looking for and what the health priorities are for the community, then we're going to create a more robust program. We're also going to create a program that is going to be more applicable to the community that we are trying to serve. And this is how we sort of lay the foundation for getting community buy-in for the program that we are developing. So that again, we are just not creating it in a vacuum. We are creating it with trans and non-binary community members. Some ways that you can do this ahead of the work plan is you could host some focus groups. You could work with, research and work with the organizations in your service area who are already serving trans and non-binary people. You can ask during focus groups or ask when you're surveying trans and non-binary people which organizations they currently work with or most commonly work with. And so these are all ways that you can start to develop your community champions and get buy-in for the program that you're developing, as well as get a better understanding of the services that you're wanting to provide. And really, whenever we're providing a public health program, we need to start with a needs assessment. And that needs assessment includes what is the research and data saying? So these are like our health surveys. What is the YRBS, BRFS, excuse me, the BRFS, the YRBS, what is data saying about the health and well-being of our community? And then actually going to the community and saying, what are your health needs and what does this look like for you? Because there's only so much that we can get in a research study. It's helpful for us to also go to the service area and talk to the people who are on the ground doing this work. So that's the first recommendation that I have with you is meet with your community champions, meet with the organizations who are already doing this work. The second recommendation I have for you is actually an internal one. So this is the introspective side of the work that we do, which is that you're going to want to craft organizational policies and procedures that affirm trans and non-binary participants and staff. It is great when we develop a program that is designed for trans and non-binary people, but if we're part of a larger organization where the program is housed or where the program is run out of, and that organization does not have policies or procedures that are affirming. So, for example, I go to a program in order to get some workforce development services. And I enter into that program. It's part of a larger facility. The larger facility does not have gender affirming restroom access. It does not have name and pronoun policies or procedures. And I'm constantly butting up against these issues within the organization. I'm going to be less likely to continue to access that service. So we want to make sure our organizational policies and procedures are aligned with affirming the communities that we are trying to serve. We do this with a variety of other services as well. So if we think about language access, right? If we're trying to serve a community that are monolingual Spanish speakers for a program, then we want to make sure that we have other services or directions within our larger organization that are available in Spanish because we know that monolingual Spanish speakers are going to be coming into our doors. So this is a way that we can be more equitable as an organization when we are trying to serve trans and non-binary people. Some examples of those organizational policies and procedures I kind of already mentioned, but some of the big ones that come up are things like pronoun and name usage. So what is the policy and procedure for your staff when referring to a participant? Is there an expectation that they will ask and use the name and pronouns that the participant shares? What is the policy and procedure for a colleague or coworker and using their name and pronoun? What is the expectation in sharing our pronouns? So all of that can be part of a policy and procedure. Accommodation usage, so that could be things like restroom usage, it could be dressing rooms, it could be spaces where folks are going to be that are traditionally gendered. So what does that look like for our organization? Are they going to remain gendered and folks can use a facility based off of their self determined gender identity? Are they not going to remain gendered and instead are going to shift to a single stall or single space for folks to have a little bit more privacy? Or are they going to shift to more of like a water closet style where it's an individual stall, but then things like sinks are communal? So there's a variety of ways that that can look. But identifying how that accommodation usage is going to be equitable and support gender expansive people as well. Some other ones are your non-discrimination policy. Does your non-discrimination policy include sexual orientation and gender identity? Does your non-discrimination policy include gender identity and gender expression, which is starting to be added into more non-discrimination policies as well? So this is a way that we can make it really clear to the folks that we serve what their rights are as a participant, and also a way that we can ensure that our colleagues are aligned with the values of the organization and that they are following those values and following that non-discrimination policy as well. So this helps to protect you as an organization, it helps to protect your colleagues, it helps to protect you as a staff member, and it helps to protect your participants as well when the non-discrimination policy includes that information. And then finally, things like dress code. This comes up a lot, especially for staff. What is your expectation around dress code? Are there gendered aspects of your dress code? I used to work in a hospital setting. And when I was working in that hospital setting, there was a dress code for men and there was a dress code for women. And so that is an inequitable dress code. And so instead, being able to be clear on what dress code requirements look like and when those requirements are actually required. So, for example, closed-toed shoes was a requirement to work in the hospital setting, and that was part of a health and safety hazard mitigation, as was having full covering over your legs. So, making sure that it's clear what the dress code is for, and that it's not just a gendered dress code. The third thing that you want to do, so now you've started doing laying some of that groundwork, and actually this will help you with this third recommendation as well, which is when you are developing your work plan, ensuring that you're including referrals for identified needs that your organization cannot address at the individual level. So what I mean by this is that if you're creating a program and you've already met with with the community that you are trying to serve, and they're telling you, hey, we really need housing support, we really need food access and money for food because we can't afford food, or nutritious food rather. We're having trouble with walkability in our neighborhood. All of these things might come up when you are doing that initial needs assessment. And so this is also an opportunity to determine who are the players in your service area who are able to address some of these individual needs, and who are the players in your and who are the of those players are also affirming of gender expansive people, to start to develop that referral network. This is also part of the approach to addressing some of the community level health needs that we sometimes we can address through a program. Oftentimes we're working with individuals, so we're addressing the individual needs, but those individual needs are often the result of community level challenges. So for example, an individual need would be, I'm having trouble with finding a job. I'm having trouble with finding a job. That's an employment issue. It is my individual issue that I need support with, but it might be the result of some larger community level issues. Like maybe there aren't a lot of entry level positions in the community, or maybe I'm overqualified for the positions that are available in the local community, or maybe the only positions that I've been able to find recently are remote positions, but I don't have access to this internet and electronics in order to function in a remote position. So there might be some community level things that are impacting the individual level. But what we want to do is we want to become almost this hub so that we know, okay, these are the health needs that we're going to be able to address within our scope as an organization and within the scope of this program. But we know that our community has other health needs that are coming up. So we have developed this referral process as part of our work plan to connect folks to employment support, to housing support or utility support, to food security support. So these are ways that we can start to develop those networks. And it gives us the opportunity to work with those organizations directly and say, you are looking for, we're looking for food security services for our program participants. We work with trans and non-binary folks. How does your organization serve trans and non-binary folks when they come into your services? So it's also a way for us to start to understand if there might be any additional barriers when folks are referred to those services. The fourth tip I have for you is to hire trans and non-binary people to serve trans and non-binary people. And what I mean by this is that not all trans and non-binary people will be qualified for the position that you have posted. There will be folks who are qualified and folks who are not qualified. But when we are creating programs to serve specific populations of focus, we want to work within the community to identify who might be qualified to work in the positions, because these are folks who are already going to have some level of trust built. Potentially, they might already be a community champion. They have a lived experience that provides them with additional experience on top of the professional experience that they have as well. So I might know that professionally, the way that a process is supposed to work when someone is referred over to a specific kind of care. But I also know personally that sometimes our process doesn't match what's actually happening, and that there might be specific nuanced barriers related to gender identity, or related to legal documentation, or related to what's on our insurance versus what is in our medical chart. So having that level of experience, which really comes from having lived through these systems that we work in, is a benefit to your organization and is going to make the program more successful within the community that you are serving. One of the ways that you can hire trans and non-binary people to serve trans and non-binary people is make sure you're advertising job postings for the programs in places where trans and non-binary people will see them. So these are the places where we work. These are the places where we play. These are the places where we live. These are our community centers. These are our organizations that are already serving trans and non-binary people, or organizations that are trans run and trans led. So even if you are working, you have a community collaborator who is a trans-led entrepreneur, a solo entrepreneur. They're working in their own company. Let them know that there are job postings that are happening, because likely there are other folks within our community who are looking to this person, or who are interconnected with this person and are looking for positions as well. So this is a way that we can start to be intentional about where we are posting this information. We also want to include an equity statement in the job posting, encouraging gender expansive people to apply. Oftentimes, unless every single thing matches up with what our experience is, we don't feel like we might be qualified to apply for a position, or we start to devalue what our personal and lived experience is. So, including an equity statement that encourages trans and non-binary people to apply for the position can give us that additional confidence boost and confidence push in order to apply for a position that we actually are qualified for. For example, in my own life, I just applied for a position that I was very qualified for and received feedback that I'm overqualified and won't be pursued as a candidate for this position. So this is an example of how sometimes we get to a place where we become overqualified, but we're only applying for the positions that we know 100% we're able to do because we have previous experience in, and then we overqualify ourselves out of it as well. So we really want to encourage folks to apply for these positions, and then include lived experience as part of experience qualifications. And that can be, or value lived experience as supplemental to professional experience, because lived experience is can build a lot of that connection with the community that we are trying to serve in ways that only professional experience can't. And so lived experience can be a very powerful qualifier for the role that you are trying to hire someone into as well. The fifth tip that I have for you is that if you are developing a program for the broader community, include some client facing documentation that the program is supportive and affirming of gender expansive people. What I mean by this is, let's say, for example, you're creating a program around vaccine equity. You know that this is a program that is going to be marketed to a bunch of different populations of focus, that there might be trans or non-binary people present within those populations, but it's not a program that's specific to trans and non-binary people. You still want to include some sort of language that allows folks to understand that this is an affirming program, and that the program is supportive of gender expansive people. And so that can include, like we did with an equity statement, it can include your non-discrimination policy as part of that program. It could include participant documentation that clearly defines the expectations of how participants will engage with each other, or how participants will engage with program staff, or vice versa, so that it's really clearly outlined what the organization is going to be providing, and how the program is going to support the participant and ensure that the participant does not experience transphobia, misogyny, sexism, racism, etc. when accessing these services. And so a part of that can be, so for example, if I'm running a program where we're doing cohort trainings, I've worked in a number of programs where we run a cohort for several weeks on some sort of prevention intervention to help folks understand how to reduce smoking or to engage in smoking cessation, to reduce substance use, to reduce suicidality. So there's lots of programs that are over a period of time with folks and might be with groups. Then we might also have participant agreements and expectations or group agreements that are developed that make it really clear that like name and pronouns will be respected, that folks will be treated with respect and dignity with regard to their name and pronouns. So these are all ways that we can integrate that into the program that we are developing and clearly express that affirmation so that participants know what they are getting themselves into and are agreeing to. The other piece of this is ensuring that you have the opportunity for and clearly defined policy and procedure for folks to be able to file a grievance as well. So if they are not being treated in the way that they expect based off of the participant expectations, if they are experiencing microaggressions, racism, sexism, transphobia from staff members or from other participants in the program, how are they able to report that? Or if they are going through the program and they're recognizing that there are gaps in the information based on what their health needs are or their lived experience has been, how are they able to share that information back with the organization and with the program? So clearly defining what the grievance or feedback process looks like and how that feedback or grievance is taken into account and actually improves the program. Which brings me to the final tip for today, which is listen to your participant feedback. What I mean by this is that I have found working in public health and in healthcare that oftentimes the feedback that we listen to is the feedback that is going to get us in trouble with some sort of accreditation board or is going to potentially cause a loss of funding. But I think that there's oftentimes a lot of feedback that leads up to those spaces that can help to mitigate that. So when we think about risk mitigation for our organizations and for our programs, we want to listen to our feedback because it can help to prevent a problem from getting bigger and larger and impacting our funding streams. So this can look like on a regular basis, so maybe quarterly or biannually, collating the feedback that has been received and going through it in order to determine how a program can be improved. I think that there is something to be said for maybe even monthly reviewing the feedback to see if there's anything standing out that is an immediate need or an immediate change that needs to occur. And what I mean by immediate change is it's causing the potential for harm, the potential for physical harm, the potential for emotional harm, the potential for danger to participants or potential danger to staff or to the organization. So how those need to be addressed more frequently. But you want to create a regular cadence so that you're taking that feedback. And if it's recommendations on things like content, if it's recommendations on things like uh, something that should be added that would be really helpful. If it's recommendations for things that just aren't sitting well or need to be maybe like re-looked at because the research has been updated, then those are things that can be updated on like a quarterly or biannual basis and are not an emergency or immediate need as well. So you want to make sure that you're listening to that participant feedback. You want to make sure that the other side of that is that you're integrating that feedback into the ongoing development of the program so that your program is improving and it's staying up to date with what is going on in our communities. Things like language and terminology shift relatively frequently. The ways that our communities use language and terminology might shift over the course of a lifetime, over our experiences, over a few weeks, right? This information is constantly updating. And so this is a way that we can integrate that and continue to provide a high quality product and a high quality program that is ultimately getting to what we are trying to do, which is improve the health and well-being of our communities by working with the individuals or with those communities specifically. So those are my tips for ways that you can build a trans inclusion program plan or an inclusive program plan for public health or for your healthcare system. Oftentimes, we're focusing on the public health when it comes to the program plan, but these are some of the ways that you can improve those programs. So to recap and summarize, in case you're just joining right now, it includes meeting with your community champions, crafting affirming policies and procedures, including referrals in your work plan and working with the organizations that are already serving trans and non-binary people in your service area, hiring trans and non-binary people to serve trans and non-binary people, clearly expressing affirmation for gender expansive people in the program materials that you put out there and in your participant materials, and listening to and integrating participant feedback. I have really enjoyed doing Ask Miss Jai Live. This is the final episode for season 4 of Ask Miss Jai Live. I am your host, Miss Jai. I use she, her, and he, him pronouns. If this has been helpful, please check out the other videos that we have done or that I have done over the last several years that are available on our YouTube at Ask Miss Jai. Please also like and subscribe to the YouTube for future educational videos like this. And yeah, I'm very excited to have been able to provide you with another season of Ask Miss Jai Live. And until next season, or until the next thing that I decide to do around education and that is helpful for you all, I want to thank you for taking the time to invest in the health and well-being of trans and non-binary communities. Be well.